Hi, my name is Alexandra Kusevich, and my poster is about the use of MRI in male children with Duchenne muscular dystrophy. Duchenne muscular dystrophy, abbreviated as DMD, is an X-linked inherited genetic mutation affecting the production of dystrophin, which is vital for proper function of muscles throughout the body. This mutation causes limited, if any, dystrophin to be produced. The lack of this protein causes a progressive weakening and deterioration of various muscles within the body. Symptoms of this condition include weakness, which can lead to a waddling gait, and difficulty climbing stairs, running, and jumping, as well as enlarged calves. Other symptoms include breathing difficulties, scoliosis, cardiomyopathy, and learning issues. Diagnosis occurs primarily through physical examination, muscle biopsy, genetic testing, or a combination of those. Multiple different imaging modalities can be used to monitor disease markers and progression of the condition. Each modality has positives and negatives. Because of the breakdown of muscle tissue that is characteristic of the condition, the affected muscles show signs of muscle tears and inflammatory reactions. Later progression into the disease is marked by edema and fatty infiltration within the muscles themselves. These characteristics can be visualized with different imaging modalities, and this information can be used to monitor progression of the condition. Ultrasound is one modality that can be used. Ultrasound is a non-invasive imaging technique that can be used to determine muscle thickness and fatty infiltration within the muscle. With this, there is a lack of anatomical detail that can be seen in ultrasound. Computed tomography, or CT, is another modality that is used in children with DMD. Similarly to ultrasound, CT can be used to evaluate muscle thickness and fatty involvement in the muscle, but CT has superior anatomical detail to ultrasound. A negative of CT is that this imaging technique exposes children to ionizing radiation. MRI is a non-invasive imaging technique used for its ability to image soft tissue. Not only is magnetic resonance imaging able to evaluate fatty infiltration in the affected muscles, but different MRI sequences can also be used to visualize edema that may be found in and around the muscles. There's extremely desirable anatomical detail that can be seen on MRI imaging while also having no known risks or side effects. It is estimated that DMD occurs in around 1 in every 3,500 live male births in the United States. As this condition is X-linked, it occurs mostly in males. Unfortunately, there is currently no cure for DMD. As the child ages, their muscles continue to weaken and deteriorate. Many of the available treatments are only palliative in the hopes of managing the symptoms. Physical therapy is used to strengthen the muscles and keep them loose as to help prolong the amount of time that the child is able to remain ambulatory before they become completely wheelchair dependent. Medications can be used to combat some of the symptoms of DMD as well. The disease is ultimately fatal, with the average age of death being around 40 years old. The purpose of this poster is to highlight the value of MRI as an important tool that can be used to help monitor and evaluate disease progression with the hopes of better understanding the condition and hopefully one day finding a cure. To create my literature review that I turned into this poster, I used PubMed and Google Scholar to collect peer-reviewed articles. One of the main limitations of my literature review and poster is that most of the articles and studies that I reviewed consisted of small sample sizes. Figure 1 demonstrates an MRI showing the increasing fatty infiltration of the vastus lateralis muscle found in the thigh as the boy ages. As can be seen in the images as the boy gets older, the dark muscle tissue is slowly being replaced by lighter, white tissue that is fat and fibrotic. These images can be used to monitor the progression of the disease from year to year within the same child. Figure 2 demonstrates the effects that Duchenne muscular dystrophy has on the heart in comparison to a healthy boy of around the same age. Cardiomyopathy is now recognized as one of the main causes of death in people with Duchenne muscular dystrophy. Cardiomyopathy is a condition that makes it difficult for the heart to properly pump blood to the rest of the body. The images in Figure 2 used gadolinium as a contrast agent in order to acquire the scans. On these scans, normal myocardium, or heart muscle, appears as dark gray. This can be seen on image C, who is a healthy volunteer with no fibrosis in his myocardium. The middle image, B, who shows the scan of a boy with DMD, appears to be a little lighter shade of gray, indicating that there is some fibrosis within this tissue. Image A shows the cardiac MRI of a boy with DMD who has severe scarring and fibrosis in the myocardium. These images can be used to evaluate the extent of fibrotic tissue in the heart and help determine if the child should take medications to improve their heart function or if there are other options that may need to be taken. Looking at Figure 3 and 4, these images show a T2 weighted map of the pelvic muscles of a 7-year-old boy without DMD and a 7-year-old boy with DMD respectively. The little rainbow in the middle gives colors to a range of T2 relaxation times, with faster times being more towards the blue-green end of the scale, and longer times being towards the red, white, and purple end. Normal, healthy gluteus maximus muscle, as seen in Figure 3, appears to be mostly green with some yellow and red mixed in. In opposition, fat has a longer T2 relaxation time than muscle, so the red, purple, and white seen throughout the muscle on Figure 4 demonstrates that the gluteus maximus muscle has almost completely been replaced by fat in this child. MRI can also be used in addition to diagnostic techniques such as muscle strength and function tests. As DMD progresses, the amount of contractile content in the muscle tissue decreases. The studies reviewed concluded that there is a strong correlation between a decreased amount of contractile content seen on MRI and poorer function on the strength and function tests. This suggests that MR images can be used to monitor disease progression and provide a quantitative estimate of contractile and non-contractile content of the tissue in children with DMD. Overall, the conclusion was made that magnetic resonance imaging is a valuable tool for monitoring and evaluating disease progression in males with Duchenne muscular dystrophy. Various MRI sequences are able to accurately visualize edema, fatty infiltration, and deterioration of the muscle. The resulting images can then be compared with healthy boys or other boys with DMD for evaluation. The images can also be compared with prior imaging in the same child for tracking of advancement of the disease over the course of time. The hope is that this information can be used to better treat and care for those with Duchenne muscular dystrophy and hopefully one day find a cure for the condition. Continued research and additional studies can help to demonstrate the value and usefulness of magnetic resonance imaging in the diagnosis, monitoring, and evaluation of male children with Duchenne muscular dystrophy. Thank you for watching.